or sometimes like this when we do webinar. Thank you, Caitlin. I appreciate you for starting the recording. So as you know, this will be recorded and we will send out the recording after the fact so folks that can have that available to them. So if you have questions about supported employment or in the east side of the state, feel free to reach out to me. If you need more individualized training, that's something that I can do. We do a variety of webinars. I think we've got about 15 of them coming up in June. If you are not already on our distribution list, I'm going to put my email address in the chat. Don't put in the chat that you wanted to be added to the distribution list. Send me an email with your request to be added to the distribution list, and we can have that happen. The gal who's kind of in charge of that list wants to see that I'm not just arbitrarily sticking people on there, that she wants to actually see that somebody said, I want to be added to the distribution list. So that's the reason for the email as opposed to just putting in the chat. Anessa, how about you?
Hi, my name's Anessa Williams. I am the Foundational Community Supportive Housing Program Manager. I am Dawn's counterpart over here in Eastern Washington, but for now I am sort of overseeing the whole state while we fill our West Side position. So nice to meet you if we haven't already met before. Oh, and just quick housekeeping too. If you have, oh, thanks, Rebecca. Nice to see you here. If you have any questions during the training, feel free to raise your hand, put it in the chat, unmute yourself. We keep it pretty conversational and casual. So please don't feel like you need to wait till the end to ask any questions.
I don't see our colleague Darren yet, unless he's another one impersonating Anessa. I think he's, we actually had some folks joining via a Teams link, and he is there and sending them this direction. So our colleague Darren is the Supported Employment Program Manager for the west side of the state, and is the person on in kind of that area that if you have questions about supported employment or want some additional training, feel free to reach out to him. You can actually reach out to any of the three of us and we'll get you connected with the right person. So we'll make sure that you have emails in the chat box, and then they're also in the PowerPoint, I believe, at the end of the PowerPoint. Welcome, everyone. So if I can make it, there we go. So not going to read to you from the agenda. You can see what we've got on there, but it really is a well-rounded training. So if you're somebody new to FCS, hopefully by the time we're done today, you're going to have a whole lot more information than you had before. A lot of things, including about Wellpoint and TAP, AHAH-RAP, Glidepath, those kinds of things. So a lot of information today. And once again, if you don't get your questions answered, feel free to reach out to one of us and we can get you connected with somebody that can help you. There is a definite lag between clicking and having it actually move forward. Sorry about that. So, social determinants of health. I'm hoping that everybody has heard either that terminology or health-related social needs. You may hear one or the other of them related to the list that you can see here, and this is not a full list. Housing and employment are strongly correlated to health. A colleague of mine, actually a mentor over the years, had shared information from a study that said people who are chronically unemployed may die up to 25 years earlier than the rest of us. And I say may. There is no guarantee. Sometimes it happens, sometimes it doesn't. The point being, it can happen. And so how can that not be a health need when in truth, chronic unemployment can impact your longevity? It is just frightening to me. So it's only one of the arguments for helping people to become employed. Same kind of thing with housing. As you can well imagine, when a person isn't housed, and I use the example of diabetes when I talk about that. Some of us who are diabetic take insulin, which has to be refrigerated. And so what does a person do if they're unhoused and they have no refrigeration and they have to use insulin? Even that one minor example can give you a pretty clear picture in regards to housing and then also employment in regards to why it's a health-related social need or a social determinant of health. Vanessa, did you have anything to add to that? I know you have good information for this slide too. The real Vanessa.
That was a great start to it. And, just to add, we can hook somebody up with all of the clinical services and treatment services and healthcare services in the world. And we know that they're not going to make much of a difference if somebody is unhoused, not able to meet their basic needs, worried about their income and where their next meal is going to come from. It's all about meeting that Maslow's hierarchy of needs. We want to help people be able to have the best quality of life possible. And obviously that starts with having your basic needs met. And FCS
Absolutely.
would
Well
direct that.
said. So FCS has been in existence since 2018, approved of in 2017 and started in 2018, but it started even before then. In the state of Washington, we had two different policy academies. So what that means is we reached out for a grant to work on the strategic planning for supportive housing and supported employment. I was on the Olmsted Policy Academy. And within that academy, what we did was we reached out to other states that were already doing a good job of supported employment and supportive housing. And we sought training. All of us, even if we're considered a subject matter expert in something, can always learn. And so we reached out to other states to ask what they were doing, what pots of funding they were using, kind of how they were rolling things out, and had training from states that said the 1115 Medicaid, waiver was one that they were using and decided that it worked for the state of Washington. So we did some strategic planning, and from that came foundational community supports. I'm oversimplifying it. It had to go through the legislature. They had to approve, additional funding. Lots of things went into it, writing information for the series. So the definition of what could be billed had to be crafted in advance of this, and just a huge variety of things that ended up happening to move us forward to what is foundational community supports. We are currently in an extension till 2028 of the 1115 medication transformation waiver. I hope that it will be continued ongoing, and I think there's plenty of reason to do that. I'm going to make a plea for when you are a contracted provider with Wellpoint, that you submit your data on a regular basis, because that's part of what lets the legislature know that this is a program worth continuing to approve of and fund. Other things to add, Anessa?
Why don't we go to the next slide? I think you already covered most of the next slide too.
All right, see how I am.
These are just some other programs and projects that are covered under the Medicaid Transformation Waiver 2.0. There are lots of services for folks reentering from carceral settings. You can see there's housing and employment on there under FCS. I'm sorry, Dawn, can you not hear me?
For me at least, your volume is very low. I don't know if that's the case for anybody else, so I don't know what you can do to boost the volume.
Can anybody else confirm? Is my voice sounding normal? Am I too
Now
quiet?
it's better again.
Weird. Okay. I'll just start over just in case the first part of
Thank
it
you.
was inaudible. But there's lots of services for folks who are reentering from carceral settings. You can see on there is supported employment, supportive housing under FCS, the MAC and TSOA programs for the older and aging adults aspect of this. If anybody has questions about any of these other pieces and programs, please let us know. We can connect you with the right folks at HCA, because you might have folks that fall under one of these categories too. Lots of great programs.
All right, so foundational community supports. Once again, I'm not an advocate of reading from a slide. I suspect that y'all can do that. So we've had questions in the past whether FCS pays for rent, room and board, wages, things like that. And actually Vanessa, isn't there something coming up? Or I think that Maureen's on the call too. Something that's FCS related that's going to pay for rent. Correct me.
Yeah. Yeah, so we're going to be talking about TAP later, which is, if you haven't heard about it, it's transitional assistance for folks who are moving into some kind of housing situation. And we also have the HRSN and Apple Health and Homes housing programs coming up too, which connect folks who need the services to a unit. And for the AHA program, that's paid by Commerce. Their rent is paid by Commerce, and I believe that's 6 months of rental assistance. Yeah, super exciting that we're finally able to actually pay rent for folks in our program, because that's been a dream since the very beginning of FCS. So excited.
Absolutely. But was that somebody else talking? I'm sorry. Keep in mind that when we talk about rents and it says that FCS is not that, it's not that. But there are programs underneath what we're doing that have started being able to do that. It's not an entitlement. So just because, folks are on Medicaid and believe that they should get it doesn't necessarily mean that they're going to. Anyone who is interested in receiving foundational community support services applies to Wellpoint or has someone assist them to apply to Wellpoint to receive services. And then on rare occasions, I had no idea there were so many different kinds of Medicaid, but there are. Occasionally, there's a kind of Medicaid that doesn't qualify a person for FCS, which is surprising to me. It doesn't happen very often, but it does happen on occasion. So not an entitlement. A person has to actually qualify for services, and we're going to talk some more about that in upcoming slides. But just be aware on that rare occasion, sometimes that Medicaid is not the right type, surprisingly enough. It was a surprise to me. Anything, I see Anessa's gone off camera for a minute. Questions about this slide or any of the ones that we've discussed so far? How we doing? And I'm not looking at the chat, so I'm hoping that Anessa or one of my other colleagues can be doing.
Yeah, I've got eyes on it. There is nothing in the chat so far. I'll keep track of it
Perfect.
throughout the meeting.
Perfect. Thank you, ma'am.
Yep, no problem.
All right. I'm not sure if we have anybody from Wellpoint here today.
I think Brandon is in here, but I'm not sure if it was actually Brandon or just.
No, it's me. I'm here.
Hi, Brandon.
Hello.
Brandon and not another Anessa. Thank you, Brandon. Take it away.
Yeah, definitely. So, I'm Brandon Knudsen. I'm one of the FCS managers, and I work for Wellpoint. We are contracted with the Healthcare Authority as the third party administrator of the FCS program, and we provide administrative oversight of the provider network, service authorizations, whether that is an enrollment, a denial, or rejection, claims payment and encounter tracking and reporting, measuring outcomes and quality improvement, and a sustainability plan. And those bottom two are really handled by our QA manager, Jacob Avery. I don't think he's on this call, but he's always, sending out the audits and making sure that everybody's on the up and up as far as the records go.
Let's see what we got for important meetings. Is that something you want to address?
Sure, absolutely.
Brandon, please.
So we do have a monthly question and answer session that we host. The next one is actually going to be next Wednesday, the 28th at 10 a.m. This is hosted by the Wellpoint team, and we provide updates, billing reminders, and training announcements. This is usually on Wednesdays at the end of the year during November and December. Holidays kind of chop that up a little bit, so we move it around. But those are great spaces to find out updates to the program, different new documents, or ways of submitting information to us, as we're always trying to improve via our, technical side. We moved from paper assessments once upon a time to now everything's online, so making things more streamlined and user-friendly. So definitely join in on those meetings. You can email us at the below email link, fcstpa@wellpoint.com, to get invited to either of these meetings. The next one is the Quarterly Advisory Council. And this is a great space for not just our provider agencies, but also other stakeholders in the network. However, they handle the program. That could be our friends at DBHR, ALTA, also known as HICLA now. They are changing their name. So you'll start to see that coming out. And then we also like to have enrollees join if they have success stories. And this also gives a space to provide feedback to the program. And we also talk about current processes, new initiatives and funding, program tools and resources and outcomes. That one gets scheduled by Jacob Avery since he's the quality manager and he handles all that. So again, you can reach out to FCS TPA at wellpoint.com for either of those meetings.
Excellent. Thank you, Brandon. And I
Mhm.
will say, when you get these slides, you'll see that some of those things are active links that should work from the slide. So including the email address for Wellpoint and additional contact information.
Yeah, so this is the contact information for the FCS team. On the left, you've got our general contact information, our phone numbers. We've got 3 email addresses, one for the FCS program specifically, and then one for the transition assistance program, and then one for AHA or Apple Health and Homes. So you can utilize these inboxes for general questions, sharing feedback, and getting clarification on anything that you're not sure of. And on the right are the 3 FCS managers. We have all of you as agencies assigned to us individually. If you don't know who your FCS manager is, you can always reach out to our FCS TPA inbox, or you can reach out to me as well since I'm on the call, and I can get you connected with whoever might be your manager. We provide things from navigating claims, handling the enrollments, providing orientations for new providers, or provider agencies that have had maybe some turnover and they just need to retrain staff. So again, myself, Brandon Knudsen, there's also Connor Chin and Chris Vela Prado. Our information is listed there.
Thank you, Brandon. Appreciate it.
Yep.
All right. So I mentioned we were going to discuss eligibility criteria for an individual to receive FCS. I say recent, but I think it's been a year ago, change was that the age at which people can be qualified for services if they meet the other criteria is 16 years old. Pretty exciting. For supported employment, obviously that could be folks that are still in high school. Supported employment does include supported education. So some of these folks that are struggling to finish school and need some supports to do that can actually receive it. If they're approved for services at 16. I think the data that I had seen from the research and data analysis indicated, gosh, I'm trying to remember what the percentage of folks that are in FCS, I want to say it's 1% or something ridiculous like that are actually in the 16 to 18-year-old category. So if you're an agency that's going to accept younger folks, I'd encourage you to do so. There's a huge need, and they're an underserved population. So individuals have to have a medical need and a risk factor in order to qualify. And you can see the list there. There's also, a variety of documents on the Wellpoint website that give you, like the provider manual that gives additional information over and above the health and risk criteria, in regards to what providers need to do to be in compliance with their contract with Wellpoint. But here's just kind of a brief overview in regards to the fact that a person has to have one under the medical necessity and one under the risk factors. And Wellpoint is the one that makes that determination whether they qualify for services. I heard somebody from Wellpoint say early on, don't guess whether a person might be eligible. Send in the assessment, ask Wellpoint, let them make that determination. They are the ones that are tasked with handling that. So don't just decide, I'm not going to refer this person, I don't think they're qualified. Make the referral and see if they do qualify. Other input to add to this one, Anessa or Brandon, or?
Yeah, I actually just wanted to support the comment you just made. If you were to select mental health as a health need and homelessness as a risk factor on a supportive housing potential enrollee, if we weren't able to validate either of those data points, we would go through every other one that's on the assessment, whether selected or not, to try and validate these folks to get them enrolled. Our goal is to get people enrolled, not to deny them enrollment. So definitely, if you're not sure, just check the boxes and let us do the rest of the research, because we have tools at our hand that not everybody else has. And so we may be able to validate them and get them enrolled.
Thank you for that, Brandon. I appreciate that a great deal. All right. Well, and in truth, Brandon, if you want to chime in about any of this, or Anessa, whoever might want to, here are the list of, some of the eligibility criteria. I think one of the ones with supported employment that I think probably happens more often than others is difficulty obtaining and maintaining employment due to, that laundry list of things going on. I know we all work with people who, their diagnosis is one thing, the actual challenges they experience on a day-to-day basis may be another. And those challenges in some cases are what relate back to kind of this criteria. Anything else in there, Brandon?
I do want to just make sure that everybody is aware that we do have a chronic homelessness attestation on our webpage. If you can validate homelessness based on the HUD definition, we do ask that you submit that to us. It's not always listed in some of our tools, whether somebody is homeless or not, if they do in fact meet that criteria. And something to keep in mind also that pulls into this particular topic, the second bullet under housing, frequent or lengthy stays in an institutional setting. If somebody's been incarcerated in Idaho and they've decided to move back to Spokane where their family is, we're not going to be able to see that Idaho incarceration through our Provider One Medicaid portal. So it's really important to gather, if they have any discharge paperwork, whether that's from any of these options, a skilled nursing facility, inpatient hospital, psychiatric institution, prison, or jail. If you have any documentation, and it's not uncommon for people to be in Montana and then suddenly they're in Washington and need help, or Oregon, vice versa, so just keep that in mind. And the rest of the stuff is something that we basically need to gather from the tools we have. But those first two are really important. There is documentation that can be provided. So always definitely send that in if you have your hands on it.
Well, I
And
know
Brandon, there's also a question in the chat here. Somebody is wondering, how long does it take for an enrollee to be approved?
So once an assessment is received, we turn those around in 5 business days. So it's pretty quick. You'll get a response within a week, a calendar week.
I have to give kudos to the Wellpoint staff, because Anessa and I and Darren occasionally will have meetings with people from other states that talk about the way the services go in other states. And I don't remember, it was Minnesota. They were discussing the fact that it's months in regards to turnaround as far as whether people are qualified for the services in that state. So go Brandon and Wellpoint team. 5 days is amazing.
My jaw just dropped, so thank you for that feedback. That's really great to hear. I'm going to share that with the rest of my team. Thank you.
Please do. If they need confirmation, have them reach out.
Okay, will do.
And we've also got another question in the chat. How long is it taking for new FCS providers to get approved?
So that's a great question. Currently, we are updating our credentialing process for new providers. We are going to be setting forth some standards that require a site visit and numerous other things that we'll be looking into for contracting. So while we are setting up that new process and getting a feel for what it looks like, we're not really bringing in any new providers at this time, but typically that takes at least 60 days, because we have to put in the information to our systems, validate everything, and then send it off to our contracting team. Sometimes that turnaround time is less than 60 days, but 60 is kind of what we strategically point to.
And another one in the chat, what would an existing provider need to do to add on housing services if they're already providing employment services?
That's a great question. If you are not sure, or if you want to add, go ahead and email your FCS manager or myself, and I can direct you to whoever that might be. We can look up and see how you're contracted. Sometimes folks are contracted for both, but maybe they just were only providing one service type at the time of starting the program. And you may be set up otherwise to be able to provide both service types. If you are only contracted for one service type, what we'll do is we'll send you a new contract that will not apply to the credentialing process that we're updating right now. So any current provider that wants to add a service type will be able to do that fairly quickly. It'll probably be the same 60-day process to get the contract signed and executed and off to you, but we will be able to move forward with any of that. So again, please reach out to your FCS manager and we can have that conversation with you.
Excellent. I'm going to add to that, if you are providing one service and thinking about providing the other one, but maybe haven't done that in the past, please reach out to Anessa and Darren and I for some additional training so that you start off on the right foot. If you're unfamiliar or have limited familiarity with the other service, please recognize that the training that we provide can help you to be successful. Other questions, Anessa? How are we doing?
I just want to add to that, just to go off of what you were saying, is it's a lot easier to provide the services correctly, building it out that way than trying to do things the right way years down the road when everybody's used to doing things a certain way and habits are built in. So back to what Don was saying, just we want to start everybody off on the right foot, and please utilize the trainers. We are very accessible. Our primary role is to help providers with training and technical assistance and make sure that you're able to provide the best service as possible. So really do consider us an extension of your own team.
Mm-hmm. Absolutely.
And we've got some more questions in the chat here. What is homeless when you live in a backyard travel trailer? Would that not qualify under the HUD definition? I think that works for chronic homelessness.
I believe that it does. We really consider somebody to be not homeless once they're in a physical building. So if somebody's been couch surfing, living in their car, or off the grid in a trailer somewhere, we would consider that homeless.
Other questions, Anessa?
Yes, Ethiopian community in Seattle is in progress of getting in contact with Wellpoint. Is there any support on this? Tesfaye, do you want to expand on your question? There you go. Yeah.
To add, of course, the process has taken us very long. Currently, we get an approval on the process. So the final contract, just on the way to ask for the final contract process with Wellpoint. I sent email to Ryan. I didn't get a response yet. If maybe there is any support from Brandon or
Yeah. So actually, you'll want to go through probably Rayanne we're really connecting folks with people at the HCA to move forward with contracting as they kind of do some preliminary work for us to ensure that you have all the training options you need and that kind of thing. They get you set up with the provider one access, and then at that point she'll introduce, or somebody at the HCA will introduce you to us, and we will then send you all of the information that you need to complete to send back to us. So I would if you haven't heard back from Rianne, I would suggest maybe just reaching out to her again and letting her know. And I'm going to go ahead and take note of this and just see if I can get a message out to her as well.
Thank you. Really.
Yeah, I don't recognize your name from any emails we've gotten or your agency names. So I think we haven't seen you pop through on our side yet, but that's definitely something we can keep an eye out for.
Okay. Thank you. Highly appreciate.
Mm-hmm.
Okay, so as you can see, the intention with referrals of individuals to the FCS program is that it's a no wrong door kind of a scenario. As an example, Division of Vocational Rehabilitation, sorry, I can't say that one time slow, let alone 5 times fast, is in order of selection, which is a way of saying that they have a waiting list. So we have encouraged them to refer people that are on the waiting list to foundational community supports. DVR counselors can provide a referral. Individuals can self-refer, parents can refer. It's really intended to be a no wrong door kind of scenario. Sorry about that. I had a call to respond to. Are there questions about that? Have folks run into any difficulties that they want to kind of get clarification for? If not, I will move to the next slide. I will mention that third item on the slide that talks about individuals can access the FCS provider map and look up the providers in their area and request that provider help them to do the assessment, to do the referral. So that's an option as well if a person seems to be lacking confidence in self-referring, they can get some assistance. All right. Supported employment services. And I haven't been able to look at the participant list to see if you're on, Darren. If you are, can you give me a holler and we'll do the kind of back and forth thing that we usually do?
That works.
Okay, cool deal. So what you see here, it says Wellpoint contracted services. Agencies will often ask us, what can we bill? What are the things we can bill? This is what you can bill. This is what's in the contract with Wellpoint when you start providing services as an FCS provider. And so it very important for direct service staff to have this information as well so that they're clear on what they're able to bill. It's broken down into 2 categories and similar for housing. In this case, FCS pre-employment services and then employment sustaining services will be the next slide. We'll discuss some more in the way of these principles when we get to the fidelity-based practice that agencies are encouraged to use. But from the standpoint of contracting and what's billable, here's your list. Where it talks about job-related discovery, that's actually a principle that was developed in the field of working with people with intellectual and developmental disabilities. It's really it's a process. It's getting to know the person and maybe asking questions of their family and finding out what are their likes and dislikes and what their history is related to learning or to types of jobs they've had that have worked or haven't worked and that kind of thing. So truly is a process. When it says or assessment, the vocational profile per individual placement and support, the evidence-based practice, is the document that agencies are encouraged to use in order to have kind of a guided way to get to know a person. It's an 8-page document before you start filling things in. So it's not little, but and I'm going to just mention what it says within individual placement and support. The fidelity item for that is don't do it in one session. I don't know about all you, but nobody gets to know me fully in one session. And so the idea is to start the process, work on the vocational profile over 2 to 3 sessions, start building rapport, start building trust. A lot of the folks with whom we work have a problem trusting, and probably rightfully so, because they've had some bad experiences. And so you've got to build that trust before a person fully opens up. So that assessment or the discovery process may take a while. It doesn't have to happen in the first session. It shouldn't happen in just the first session. Person-centered employment planning, we'll talk more about that. And in fact, we're going to talk about most of the things on this list. One that I'm going to mention is job carving and customized employment. Individual placement and support does not recognize job carving because it's not competitive employment. I apologize, I have a little fruit fly No, I'm not seeing things. Um, Customized employment is really about those folks with whom we work that have the most significant challenges. So not everybody that we work with is just going to slide into a job description. There may be pieces of that job description that they can't do. And for those folks, sometimes agencies will talk to employers about a piece of a job description that the person has strengths in doing and that the business owner needs. An example being one that was done in Moses Lake when I was living there was job carving at Safeway, where an agency helped a person to get a job cleaning the bakery and cleaning the meat department. They couldn't make change. They couldn't read recipes and do measurements. They just didn't have those number concepts. And waiting on customers was not something they were going to do readily, but they could clean like crazy. And Safeway recognized the fact that would be of benefit to them because it would free up the folks in the bakery and the meat department in waiting on customers and producing product and things along that line. So that's an example of what might be customized employment. Not approved of by IPS, is a billable service because it's needed with some of the folks with whom we work. Probably, I don't know that I can call it rare, but it doesn't happen as often as the run-of-the-mill job development. And then where it says transportation only in conjunction with an authorized service, essentially that means that your meeting space is the car. So an example of that is if I was taking a person to do a job interview, in the car on the way there, we were practicing job interviewing. And so it was just a matter of location. I was doing my session in the car as opposed to in the person's house or a coffee shop or the community, or that's the only real difference there. So that's why it says only in conjunction with an authorized service. You have to be doing your session in whatever the transportation is on the way there. The rest of them, I think we're going to cover as we go. In greater detail. Darren, do you want to do the employment sustaining services?
Sure. So as Don said, we're building that relationship with the participant and the job seeker. And we really want that relationship to continue after the person either starts a job, starts a training program, or maybe even goes to school, to really, what kind of things do we need to do to help someone? Or we might be working with somebody and that they share with us, maybe they're underemployed or they need, more assets, more income coming in, and looking at maybe there's some potentials for career advancement within the company that they're with. So I've had experience sometimes helping people get jobs that they say, thank you very much, Darren. I'm doing great on the job. This is my job. I'll see you later. But we really focus on that assertive engagement piece with the evidence-based practices of IPS so that we continue to see what's going on. I've seen a lot of folks, unfortunately, start a job but really have some challenges maybe in the first 30, 60, or even 90 days, or maybe they don't make 90 days because they didn't have that ongoing support, where maybe an accommodation could be really important to advocate for somebody, or provide that additional on-the-job support through job coaching or consulting, or working with the supervisor or store manager in terms of things that we could create problem solving to increase the functioning of the employee, and also, sharing updates with management to see that there's a progression going up. So definitely a very critical piece of, how we sustain somebody through employment. Another piece that's really important is thinking about how earned income now impacts some of their state and federal benefits. So that we're doing the revisit once again in terms of seeing how income might impact benefits so that people aren't unpleasantly surprised if they do have Social Security checks coming in, that they see a decrease, that they're aware of those decreases and they can plan their budget accordingly. And also that maybe we're thinking outside the box and how to create more sustainability. Maybe we're talking about an ABLE account. Maybe we're talking about some different things that people can do with some of their income to plan for the future. So definitely there's a lot of opportunities, and the flexibility within the Wellpoint services, how we can support folks and build those natural supports with somebody that might be in the community, might be around the job, to really make them more independent out in the community.
So I mentioned the evidence-based practice of supported employment. Back when, in that historical context, we were receiving education from other states and what they'd done that's worked, that we then incorporated into foundational community supports. One of the things that the legislature said is that that agencies need to use evidence-based or promising practices in the services that they're providing to individuals. For supported employment, that's what individual placement and support is. So you can see there are 8 items noted here. There's actually 25 items on the fidelity scale, or the recipe for how to do it. Most of the items fall in under these 8 topics. So there's not 8 principles, there's 25, but 8 are the primary principles that most things fall under. Competitive employment is the goal, meaning a job that's in the community that others could apply for, that are not just held by people with disabilities. So not sheltered workshops, not the social endeavors where only people that with disabilities are working there, but actual competitive employment. That's where I talked about the customized employment. That doesn't fall under the competitive employment, but is acceptable with Wellpoint and HCA as far as a billable activity, because some folks need that in order to succeed. IPS employment is integrated with treatment. Individual placement and support was originally developed by Dartmouth University 25 years ago, something along that line. And it was developed for people with serious mental illness. The folks that work in the DDA system, the Developmental Disability Administration, I know their name is changing, and I'm not sure. Developmental Disability Community Services, I think, is what they're changing to now. They've always done a good job of helping people with employment. Working to do employment with people with serious mental illness had kind of lagged behind. Back in about 2015, when we had the Olmsted Policy Academy and we're working on moving forward with supported employment, the data showed that the employment of people with serious mental illness was about 14%. 86% unemployment of people with serious mental illness as an average, and that was nationwide. And so that's part of the reason I think that the folks from Dartmouth developed the program specifically around people with serious mental illness. What's happened in recent years is they've done studies to see, does it work with other populations? It does. They've done studies of people, veterans with spinal cord injuries, parents on TANF, folks with substance use, particularly opioid use disorder. Works with all of those populations and with folks with intellectual and developmental disabilities. So where it says IPS employment is integrated with treatment, the idea is there, if a person on your caseload receives services from another agency, you should be collaborating with them. You should all be on the same page. That's the bottom line there. And if you're a mental health provider, you should be collaborating with the therapists and the case managers and the med prescribers and the whomever. But if it's someone that works that is receiving services from, another kind of state agency, you should still be collaborating and staying on the same page and wrapping the services around a person. Zero exclusion, kind of what it sounds like. If a person says they're ready to work, they're ready to work. IPS, individual placement and support, goes into greater detail and says in the fidelity scale, doesn't matter if they're using substances, doesn't matter if they're unhoused, doesn't matter if they're symptomatic in relationship to mental health. If a person says they're ready to work, they're ready to work. I'm going to argue that any of us may have challenges that on a given day we're not ready to work. Folks would have said about me, I have anxiety disorder. And about 15 years ago, I remember doing a presentation to about 50 people. I had a panic attack so bad that I couldn't continue and my co-presenter had to take over. There would have been people that would have said that I am not ready to do this job. They'd be wrong. I get to make that determination. Nobody else does. And it's the same thing for the folks on our caseloads. I've seen people actively using substances that quit because of the job. I've seen folks that had cycles of incarceration that their, recidivism decreased because they were working and had that positive influence in their life. So zero exclusion, incredibly important. Preferences of the individual are honored. If anybody's had a job that they absolutely hate, that they took just because it was a job, you understand why preferences are so important. It increases success if the person's strengths, skills, interests are being taken into account as their help to find a job. Darren, benefits planning, your shtick. Time for you.
It is my stick. Thank you, Don. And again, this is so critical for folks who may have spent years trying to achieve some of the federal benefits, SSI or SSDI, supplemental security income or disability income, where somebody had worked in the past and had paid into the system. So I've met individuals and sometimes families who are very guarded about, what is this idea, Darren, that you want my, family member to go back to work and disrupt those benefits that we worked on, particularly, some of the medical benefits and the Medicaid that comes with SSI. So I think it's always a great process to start in that discovery process so that you can find some of those potential pain points and fears that people have about change coming up. Because just looking for a job can create a lot of change and feel chaotic at time, but can also give people a sense of purpose to move from where they're at to something new and different with different supports. So I really think benefits planning is so crucial at the beginning of the conversation and throughout as you're looking for different employment options for folks, that you can go to Pathways to Employment and use that benefit estimator to kind of see what earned income can do to people's benefits and how much they can actually make and maintain their Medicaid benefits, or to educate people about SSDI and some of the intricate work incentives that could be around that, with substantial gainful activity and trial work periods and those things, and how to keep their Medicaid during that. So definitely there's a lot of technical information, but we definitely encourage folks to reach out to Don and I and Anessa to kind of, if you have some needs about some more information, hopefully we'll be providing some more trainings into the new fiscal year with some of the training partners that we have. But definitely always keep that in mind, because I don't particularly like surprises, particularly when it comes to finance. And I think most people are more open to a plan and the support. And please remember to educate people about reporting their wages. If not, when somebody goes back to work, Social Security does share information with other government entities, and it could be ending up in an overpayment. And the new administration right now is working very aggressively to recoup overpayments for individuals. So a great plan from the get-go is to avoid all that and report your earnings with Social Security. The next one, we're thinking about that rapid job search process, that if we're providing employment services, how are we intentionally helping somebody make that transition? Are we working through that career profile and getting to know somebody like Don had mentioned? And then are we going out into the community to look and visit and talk to employers? Maybe we're doing that in our role as an employment specialist, but we're also modeling some of those skills and abilities with our job seekers. So we just want that intentionality. And for high fidelity, that's happening within 30 days. Not that everybody has to match that level of intensity, but we should be intentional. If we're talking to people, developing, resumes, talking about references, developing cover letters, those type of things, we should also be out working our communication skills, interpersonal skills to build some relationship with employers and help people get interviews at those types of businesses. So I've worked with through Fidelity Views, I've visited some places, and that process can take up to 270 days. So that's a long time to tell somebody we're going to move towards employment, create some new opportunities, but there's that stagnation. And a lot of times when people don't feel validated, that they have an idea, do the research and follow along, some of that spark can be diminished. And we want to kind of keep that flame going and motivation and, hopefully reach some of the expectations that they've had during the discovery process. So we know what that goal is and can find a good job match for that person. Job development takes time. It's definitely an expertise. Definitely we have a lot of training opportunities for folks. I think June, we have a boatload of trainings coming up, and we really encourage people to jump into those. But we also have some other supports going on a regular basis with Rutgers University. So definitely we know job development has some expertise, but it also is a system in terms of being able to have your caseload, track those employers that you're going to, be able to track interviews, track wages that people are earning. All those different elements can really compile a great story of change and success and more independence in the community. But it also takes time to gain some of the expertise. So we really encourage folks to visit the IPS library where you can access free information, make it your own, and incorporate, what the career profile is, what is a job search plan or a job support plan, start dates for jobs, end dates for jobs. We can, focus all that kind of great information into a usable tool. And definitely, folks, to check out our Pathways to Employment site so you can download the client log, job seeker log that we have there to incorporate all these different elements together for a well-rounded program. And the next one is time unlimited supports. So this is definitely tied to the FCS benefits for supported employment that we can continue as long as they need the services. And this is a great selling point for those folks who might be CRPs or might be interested in working, with a division of voc rehab. This is a great time to be able to provide longer term supports after maybe DVR contracts end, that we could continue that success in a job for somebody who actually can still benefit or provide those kind of supports, so we can taper back or create those natural supports so they could take on some of the support roles to make sure somebody's successful in the job. So it's a great tool to advocate and show that because of FCS services, we have some of those long-term supports that other community providers aren't able to access. So it's a great benefit for folks. Back to you, Don.
Alrighty. This is a lot of information, and we recognize that. Good news is you're going to get the PowerPoint. Better news is, if any of this is still kind of confusing, we can do additional training with you. So keep that in mind as we go. If you're feeling a little bit overwhelmed, feel free to reach out to us and ask some additional questions. So I mentioned that individual placement and support is a scale of 25 items, and that those 8 covered most of them. Having some tendencies towards OCD, I had to include the list of things that aren't really covered in that. That's my thing. So what IPS encourages is caseload of 20 or fewer for supported employment. I know supportive housing is even a little lower than that. But the idea in both cases is so that the caseload is not so large that a staff person is unable to do all the services that an individual needs help with, is to make things manageable and to improve the quality of services. Now, having said that, individual placement and support have and supportive housing have the different principles that they suggest, and also recognize that agencies have to keep their doors open. So related to this caseload of 20 or fewer, I worked for an agency that decided that our caseloads needed to be 25 because financially that brought in enough income for us to keep the doors open. IPS is not, and PSH, Permanent Supportive Housing, neither one is an audit, a mandate. You have to. It's for best services, for the best quality. Here are the recommendations. Do as many of them as you're able. Try to do all of them. But in some cases, you're maybe going to have to modify a little bit based on the needs of your company as well. So know that that's the case. Collaboration with Division of Voc Rehab. Nationally, there's an entity called the Rehabilitation Services Administration that is the parent company, if you will, for DVR. Division of Voc Rehab, the intent in the state of Washington and in other states is for them to be the agency that helps people with significant disabilities to become employed and to maintain employment. So we want to see FCS providers collaborate as much as they're able with DVR. Employment specialists provide only employment services. For those of you considering providing FCS services, I know that we have had agencies that were just starting out that had one staff do half housing and half employment, or at least that was the intent. What I will tell you that as a fidelity reviewer I have seen is it never ends up being half and half. And I've experienced in the agency that I worked for 21 years where we lost funding for supported employment, became case managers with a specialty in employment. And because of so many of the emergent things that happen in the housing field, I never got a chance to do employment. So what IPS says is that employment specialists really should provide only employment services, and that's the intent. That they should be a vocational generalist, meaning that if a person is referred to the program, the person that they see to kind of do the assessment is the same person that does all the other employment services throughout, that they're not hopping through an intake person to a job developer to a job coach it's the same person, so that staff person can really get to know the job seeker well, and that they're the one that helps them throughout. Jobs are found in the community. Yeah, I know there's a lot of online stuff, and yeah, I know almost every employer these days wants you to apply online. That's not where the relationships are built with employers. If you go to do customized employment as an example, it takes the employer trusting you as an individual, as an employment staff, in order for them to be willing to take on the customized employment for that person. So relationship building is huge, and part of that comes from the time in the community, face to face with employers, and with resources and with educational opportunities and a variety of things, and helping the person to get back out into the community and kind of, to cease isolating, because I think a lot of the folks with whom we work, that's kind of their life early on, is that isolating, and we need to help them get back out in the community. Discussion around disclosure. I've been on the side of the table receiving fidelity reviews in the agency that I worked for. The question was, do most people allow you to talk to employers? And my response at that point was, no, they don't. They don't really want us to. And we pretty much got told we were doing it wrong. And the more that the fidelity reviewer explained, the more sense that it made. If I was to talk to any one of you and said, can I talk to an employer on your behalf without giving you any additional details, are you going to say yes? My guess is probably not. If I tell you, Dawn, I know you have schizophrenia, and that's what I want to tell an employer, my response then is going to be no. But if somebody says, Dawn, I know you have schizophrenia, so, and I don't, by the way, but I do have anxiety disorder. I want to tell the employer that you have some difficulty with concentrating. So we found that a checklist resolves that problem. That's something I might say yes to. And those are the kinds of things we were doing wrong, if you will, that we changed when we started having those disclosure discussions. Specifically asking the person, what can I tell the employer? I had folks that were in active substance use disorder that said, please don't tell the employer I'm in active substance use disorder. Why would we? That's not a selling point for the employer. Just the same as if somebody does have schizophrenia and you say that to an employer, do you get any warm and fuzzy feelings when somebody says schizophrenia? The media has not been our friend related to some of the challenges people on our caseloads experience. And so talking about the behaviors makes more sense and makes the person more comfortable. And those things have all got to be documented. Assertive engagement. I'm here to tell you, in the about 35 years that I've done supported employment, a lot of the time when a person says, I don't want to work, that's not what it is. They're fearful of losing their benefits. They've been told over and over again that they can't do it. They've had some bad experiences at a job because of stigma and how they were treated by coworkers or whatever it might be. So that assertive engagement, a big piece of it is trying to figure out why the person isn't coming in anymore and changing that if possible, and continuing to reach out and not just kind of taking at face value, that they're not coming and assuming they don't want to work or they don't want to be housed or whatever, but trying to dig down deep for that real reason why they're not showing up anymore. Questions, comments? I don't know if Kimberly's here today to do the glide path piece.
Hey, Dawn, I was gonna ask, where did the housing slides go?
Well, that's a really good question. That's a really good question.
And Dawn, you're
Um,
awesome, by the way. You're a real person. Thank you.
Oh, yeah, true story. That would be the truth. And Anessa, I'm gonna, while if there's somebody that wants to take on the glide path slide, I'm gonna go back and look through my other slides and find where the housing piece went and pull it up. So is there Darren or Anessa, do you want to do the glide path piece?
Yeah, I can talk a little bit, about Glidepath. This is definitely a new program that's been going on for a little while and getting funded to continue, but it's working across the state to really help identify those folks who have that potential, to think about employment in terms of some of those services and focus on changing where they're at, particularly looking at those folks who are currently HEN eligible. And historically, the HEN program had, some timelines in terms of receiving the benefit and work with providers to transition off the benefits. Now, there's been some changes in the legislation, so that might impact, some of the folks, but we're looking to expand that eligibility population. Because we know with the housing demands in Washington State, there's definitely more demand than units that are available. So there is that potential population to really focus about how do we engage folks in supportive employment activities and bring in that benefit education to really create some forward momentum for folks to change. I think Kimberly, who's the contract manager for this program, just shared that somebody was able to, who had some Social Security benefits, was able to achieve employment. And now they're making progress so that they can think about their next goal, about a home purchase. So there's some really dynamic things that are happening within the program, with some of the core things, about benefit planning, because as we know, earned income can change your federal and state benefits. Really looking at implementing some of the FCS services to really help people think about those next steps. And they have something really unique where they have some support funds to help somebody. Sometimes that's helping them get their driver's license back, maybe making some car repairs, maybe paying for some training so that person can, achieve a livable wage during their transition. So definitely, if your organization is working with some folks and you know that they're HEN eligible, you can work simultaneously with some of the other providers who have the HEN contract. And you can definitely reach out for some more information from Kimberly Cancel. Thanks, Don. Hopefully that was enough time to find the housing slides.
Yes, it sure was. Share my.
So I'm going to stop sharing and let Anessa share her screen. I don't know what happened that we lost those slides, but
Yeah, we lost a few that we
there's
were
proof
meaning to.
positive. There's proof positive that I need not to share my screen in the future.
We lost a few that we were meaning to talk about. Is it okay if I go back to the how to talk about FCS? Because we didn't cover that today, right?
I think that's actually the kind of the next thing that was gonna be covered. So why don't you cover the housing?
Okay.
And I'll take a look at the slides and see where we're at with the next stuff.
Okay. Perfect. So the other side of this, Darren and Dawn just talked about supported employment. I'm going to talk about supportive housing. Let's start by just defining what permanent supportive housing is. You'll hear that term used in two different contexts. One obviously refers to a physical building, like a permanent supportive housing building, usually like agency owned and operated and has supportive services inside of it. But the definition that we're using here is PSH as an evidence-based model that connects folks who are unhoused to affordable housing and provides services to them as well. So in this context, we're referring to it as an evidence-based practice and a service model rather than a physical building. To break down this definition a little bit more, when we say permanent, that means that tenants can live in their home as long as they continue to meet the obligations of their lease. So it's not transitional, it's not temporary. They are welcome to stay as long as they want to and as long as they continue to uphold their end of the lease and pay rent, etc. Supportive means tenants have access to services and supports that they need and want to stay in housing. And we will talk about what all of that can entail and how to provide those services in a little bit here. In housing, obviously, tenants live in a private and secure place, just like other members of the community. We want them to be able to close and lock their door. They choose who they let in. They choose who comes over, all of that kind of stuff. And what effective PSH looks like, I like to use the analogy of like driving a car. The participant is the driver. They are ultimately the ones making the decisions about which direction to go. And you as a staff are in the role of the GPS. You can provide them with the different routes, the different options that are available to them. You can give them the pros and cons of each option. You can tell them what you think you would do in that situation. And ultimately, they're the one that's in the driver's seat. So they have the ultimate say on what they're going to do, because of course, nobody is going to know better what's going to be best for them than the person themselves. We want the participant to be able to make their own decisions. You're just giving them all of the information they need to make that informed decision. And it's really important that that information's unbiased as well, right? We all get really attached to our folks sometimes, and we might have really strong feelings about, oh, I wish that they would, just do this. But if that's not something that they're interested in, or if they want to go a different direction, it's ultimately up to them. And we need to be really mindful of our own biases. Because we don't want to put that onto our people. We want to just give them the information to do what they want with it. And obviously, every individual person is going to have very different needs. We can have 30 different people on our caseload that are all unhoused looking for housing, and each situation is going to look super different in terms of what kind of barriers they have, what kind of housing that they're interested in, if they've been housed before, if they're working, what part of town they want to live in, what other services they want to be involved in. Every service plan is going to be so individualized, and because of that, the way that we interact and provide services needs to be very individualized as well. Okay, so these are the this is the evidence-based practice, permanent supportive housing. I'll go over all of these dimensions briefly here. The first one is choice of housing, and this is the one that I would kind of consider the overarching dimension, because there's no way to do all of these different pieces perfectly, but choice is kind of the one that it should always default to. If that makes any sense, it probably will as I continue talking, but choice of housing refers to lots of different components. We want to see that folks are being educated on all of the different kinds of housing that is available to them, including, home ownership, renting a room, transitional housing, Oxford housing, tiny homes, all of that kind of thing. Folks might not be aware of all of the different options that are out there for them, and it's our job to provide that information, right? Choice of housing also means if maybe you are looking at an apartment building and there's 3 different units, is your participant getting an option to look at all 3 of those different units, rather than just you're forcing them to take whatever is open or whatever is the first available thing. One might have a floor plan somebody likes better. Someone might need to be on a first floor or might not want to be on a first floor. There's lots of different reasons that one unit over another might be a preferential option. And We know that when folks have choice in the kind of housing and where it is and what it looks like and all of that kind of thing, they're going to be more invested in keeping that housing. And that's what we want. We want to get people housed and we want to keep them housed. Choice of housing also means that ideally somebody gets to choose if they live with somebody else and who they live with. Obviously, that depends a lot on, if they're using some kind of subsidy or voucher and what kind it is. That one's going to look a little bit different if you are just like working with somebody on Section 8 versus if you are working with somebody who wants to go into transitional housing where they're going to have a roommate, obviously. But ideally, we like to see that people get a choice in that because who you live with makes a big difference in how well you are able to maintain your housing. The next principle is separation of housing and services. And this means that we need the landlord role and the housing support role to be very, very distinctly different and separate. For example, somebody who is a housing specialist should never be collecting rent, doing inspections, posting notices, posting 10 days, things like that. And a landlord is probably also not the person that somebody is going to go to with their housing barriers. For example, you can go to your housing specialist and say, hey, I'm having a really hard time setting boundaries with my son. He keeps staying over here. I keep telling him I don't want to get in trouble. I'm not allowed to have guests over, and he keeps coming over and staying the night, and I don't know what to do. If you tell your housing specialist that, you can have a really good conversation about boundary setting, about helping find resources for your son so he doesn't have to stay there, things like that. Whereas if you have a conversation like that with your landlord, they're going to say, I'm going to start doing weekly inspections to make sure he's not there, or I'm going to give you a 10-day notice and you can sort this out, or you're evicted too. Very different responsibilities there, so the roles need to be very separate. It would be really problematic for those people to be one person because then neither of those roles would be done very effectively. And I apologize, I cannot see the chat while I'm screen sharing, so if there is something, Dawn, Darren, could you just let me know?
Yeah, I'm watching.
Okay, awesome. Decent, safe, and affordable housing is the next one, which means that ideally folks are living in units that can pass HHS and HQS inspections and are 30% or less of their monthly income is going to rent and utilities. And of course, if somebody is utilizing some kind of housing subsidy, that's always going to be the case. But if somebody is not utilizing a housing subsidy, we still want to see that those things are true. And of course, if somebody is interested in living in a place that is maybe 40% or 50% of their monthly income, that's still, it comes back to client choice at that point, right? We can absolutely have a conversation with them about, hey, I'm kind of concerned if you move in here, that's a lot of your income every month. How are you going to make sure you have money for food and transportation and healthcare, etc.? As long as we could see that that client had a robust conversation about those pros and cons, they really know what they're getting into, that's totally fine because we know that happens sometimes. It can be really hard to find a place that is only 30% of your income. Community integration is the next principle. That one means that ideally the folks that we are working with are housed in units that are typical of the community. They are ones that any of us could walk into and rent. They can just very easily blend in. You could drive by and have no idea that the person that lives there is involved in any kind of services. We know that with the big buildings that have the agency name and logo on them, there can be a lot of stigma attached to that, or even just those parts of town. And, if somebody is attempting to become employed or even just going out and making friends, that might be more difficult if they are in a very clear segregated part of the community rather than just being able to blend in with everybody else. And that being said, some people absolutely opt to live in those big buildings or live in transitional housing or set aside units for whatever reason. Sometimes that's just what's available. There's absolutely nothing wrong with utilizing those options. And again, it all kind of comes back to client choice. That's just the ideal that somebody is living in a typical unit that any of us could rent. Access to housing is the next one. And this means that whatever somebody's barriers are, we are going to help them look for housing, and we're going to do it as fast as we would help anybody else. For example, we're not going to tell somebody that they need to get treatment before they can become housed, or that they have to attend, X number of case management sessions before we're going to consider looking for housing with them, or anything like that. We want to keep it very low barrier, very housing first. We are going to help you find housing, and then whatever you want to work on after that is totally up to you. Access to housing also refers to folks being able to close and lock the door to a private space as well. Whenever we talk to agencies about what this looks like, we want to hear something like, there's no reason for us to enter somebody's unit without them or without their permission, unless it's an emergency situation. And then in that case, it's the fire department or it's the police that are opening the building. We don't want to see anything like, oh, I was supposed to meet with them for case management and they didn't show up, so I went to their room and opened their door. That's not giving them the same rights of tenancy, the same level of respect and privacy that any of us would expect. We want our clients to obviously have that same privilege that we do, to feel safe and secure in their own units. Rights of tenancy refers to, it's really important to look at the lease with somebody prior to them moving in, prior to them signing the lease. It's important that the participant is aware of what the expectations are on the lease when they're moving in. And it's important that we look over it to make sure, are there any rules in here that they don't understand or that might be hard to follow? Or is there anything in here that we wouldn't find in a typical lease? Like, for example, if there's mandated drug testing, if there are restrictions on what hours guests can come over. That's not a typical lease. That's something that would probably be more likely found in transitional housing or in a PSH building. And again, those programs have those rules, and that's totally fine. And ideal perfect fidelity says that we want people to just have regular standard leases. Would always recommend going over them ahead of time with somebody, because when they get the keys in hand, all they're going to want to do is move in and enjoy their new space. Of course, sitting down and reading a very dry legalese lease is not very much fun, not very exciting when you're moving into an apartment. So doing that ahead of time so that the person understands what they're getting into and what all it involves is always the best practice there. And then flexible and voluntary services is the last one. And this refers to a few different things. First of all, folks should be able to decide when, where, how often they're meeting with you and what they're talking about during that session, what kind of services that they're interested in pursuing. If somebody wants to do case management at the library or at their home or in the office or on the way to the grocery store, any of those are totally valid options. If somebody wants to meet with you every single day at one point because, maybe there's a crisis or something, and then they tell you, hey, I don't need to meet with you for a couple months, just check on me in a couple months. Both of those are fine. We want to see that the intensity of services is matching the individual's needs rather than you need to show up every Monday at 9 a.m. to meet with me regardless of what's happening, right? We also want to see that services can be offered on a flexible schedule. So maybe there are staff that work staggered shifts. Maybe some staff work on the weekends. We also like to see, if it's possible, maybe a 24-hour crisis line. When I was a provider, we had a team of 12 case managers and everybody would take turns taking the on-call phone for a week in case of after-hours crises like fires, assault, situations with neighbors or property damage. It was a great way to continue to support our people with housing during crises where folks were potentially at risk of, getting in trouble with the landlord, being taken to jail. Lots of situations like that were mitigated because we were able to step in and mediate and assist with those situations. Flexible and voluntary services also means that folks can choose whatever kinds of services they want to participate in and can choose no services as well. If somebody gets housed and then decides like, hey, I don't want to work with you anymore, that's totally fine. And if somebody says, I'm not interested in participating in treatment services, that's totally fine too. And remember to check back in with folks, right? They might change their mind about something, or this also refers to if somebody expresses interest in participating in, in anything, peer services, clinical services, treatment services, etc. You can either provide that service in-house at your agency, or you know who to connect them with and how to help them make a referral, do a warm handoff to another provider in that community so that they can get that need met when they're expressing that interest. Okay, that is PSH. That is the super fast version. Oftentimes that is an 1 to 2 hour training. So that was just the real quick version. I'm happy to answer any questions about that if there are any.
And while folks are thinking about the questions that they want to ask Anessa, I want to say again that there have been a number of questions about whether you're going to receive the slides and the recording. You will if we have your name. And so those of you who have signed in and it still says Anessa, I need for you to pull up the participant list, find your Anessa on the list if you can, and then change to your name so that we've got that. Anessa, you have a question from Melissa. Can someone take the more extensive training for supportive housing?
Sorry. Oh, you said more extensive?
Yes.
Okay, sorry. I heard more expensive. Yes, absolutely. Please send me an email and we will set up a time to talk and do some more training. Would love that.
And I'll put your email on the chat box so that
Thank you
folks
so
will
much.
get it. I don't see other questions at this point in time. Anessa, and I apologize, I don't know what happened in regards to the slides, why there were some missing. Did you also go over the Wellpoint contracted services that are billable?
Nope, I did not do that.
So maybe
Yeah,
that
that
missed?
wasn't all of my slides were missing, huh?
It's not,
I'm so
I don't
sorry.
know
I
what
should have
happened.
started. Yeah,
I
I should have started
apologize.
with this. Pre-tenancy supports that you can help somebody with, so services before they're housed, any kind of conducting assessments, and like Dawn was saying, I believe about the supported employment assessments, they don't have to be a checklist. They don't have to be done all at once. It can be very conversational, very natural. It's a great opportunity to build rapport with people as those conducting of assessments. That includes the Wellpoint assessment as well. We also love to see any kind of assessment about like what's your ideal housing situation, that kind of thing. Initially, when you talk to somebody, they might say like, I just want to be indoors. I don't care what kind of housing you get me. And then the more you talk to them, you're going to see that's not true. There actually are, some specifications that they have or some particular things they're looking for in housing. So we want to be able to ask those more probative questions to get some good answers and help match folks with housing that's going to be ideal for them. Any kind of coordination of care. So if you are working with other agencies or if they are working with other agencies or other providers, we want to see that there's lots of conversations between all those providers so we know who is doing what, who can help with which pieces. Are we all, on the same page about this person's goals? Coordination of care is also considered a collateral service, meaning that the participant does not necessarily need to be with you while you are providing that service, and it can still be billable. Obviously, ideally, the participant is always going to be present because when you're having a conversation about their care, they should totally be involved. But we know sometimes you might get a call back from a landlord or another provider and your participant might not be right next to you. And as long as you've had a really good conversation with your participant about disclosure and there's an ROI in place and they are very aware of what you're going to be discussing and what's, off limits as well, it's totally fine to have those conversations and bill for them. Development of community supports. This can look like anything from helping somebody like navigate the bus route in their neighborhood, hooking them up with other services, helping them build natural supports, helping them find like the closest food bank to them, helping them get like a primary care provider. Any of that kind of stuff would be considered development of community supports. Treatment planning. So any kind of establishing short-term and long-term goals. And we also have a sample housing stability plan that can be a really great template for this as far as breaking down, find housing is a really big goal. How do we break that down into like, I'm going to call 3 landlords a week. I need to get a replacement ID, all of the little steps that might be underneath that to go towards finding housing. Any kind of advocacy and landlord liaising, especially if maybe we're working with folks who have past evictions on their record or past justice involvement, it can be really helpful to help coach them on, how do we talk about these things, or how do we maybe write a letter on our behalf to a landlord where we can explain this is what was going on at the time, this is what's changed for me, these are all of the supports that I have now. Having those conversations or writing those letters can really go a long way in getting a landlord to take a chance on somebody that on paper might not look like an ideal tenant. Any kind of financial skill building and benefits support as well. So whether that's like helping somebody get on SSI, helping somebody do like a monthly budget for if this is how much we're spending on rent and this is how much we have left for everything else. How do we make that work? How do we save money if we want to do that? Interestingly too, you can bill for things that are employment related under housing, but it does not go both ways, right? Because obviously if somebody is able to be employed, they're going to be more likely to be able to pay their rent long term. So that's why if somebody for whatever reason qualifies for supportive housing but not supported employment and they're working on employment, you could put that under housing. Just don't try to do it the other way. Don't try to bill for housing under employment because that doesn't work. And then tenancy sustaining services. It's really important to proactively have conversations with folks when you start working with them about like, hey, yes, like I can help you find housing, and there's so many more things that I can help you with after you're housed too. We really want to set the precedent that somebody can continue to work with you after they're housed, and you should continue to work with them after they're housed because they're, like Dawn was saying, you can't just get somebody a job and walk away and wonder why it doesn't work out. Folks are going to continue to need that support after they're housed as well. Coordination of care obviously is going to continue to be relevant for something to work on. Like I was saying, employment or vocational support. I've had lots of conversations with folks where after they were housed and they started to feel comfortable and safe and stable, we would have conversations where they're like, I'm bored. I don't know what to do with my time. Or like, it's great that I have this housing subsidy and I only have $600 a month and that's not enough for everything else. I believe Don and Jared said this too, but if you just ask somebody like, hey, do you want a job? The answer might be no initially, right? But if you can ask somebody like, what do you want to be doing with your time? What are you interested in? What kinds of stuff have you done in the past that you liked? All of that kind of stuff can be a more gentle way to sort of broach the topic of employment services, education, things like that. Informal community support development. Again, that can be, what is walking distance from your new place that you want to be able to go do, or how do we make friends with our neighbors, or what kind of natural supports can we build, anything like that. Development of independent living skills as well. I've worked with lots of folks that were chronically homeless for several decades and lacked a lot of the skills that we all take for granted living indoors every day, right? It's really important, if it's okay with the participant and if you're comfortable with it, that we can visit them in their units and see them and get eyes on their place, because that's going to give you a great window into what might they still need help with, what could I work with them on. Like, for example, I worked with a gentleman who didn't know what he was supposed to do with like produce after he cut it up. Like, how do you store it so it doesn't just immediately go bad? I've worked with lots of folks that weren't aware of why exactly it's important to have a shower curtain up when you take a shower, right? And if you don't know that, and if you're living, on the third or fourth floor, you can cause a lot of water damage to the units below you, and that's going to get you evicted again. Just little things like that, even helping folks like, worked with lots of folks that would get, tons of like rice and beans and things like that from the food bank. And we're like, I don't know how to cook with this. Let's find some recipes and let's work on how do we cook meals from scratch in our apartment? How do we keep it clean for an inspection? All of that kind of stuff, totally relevant to helping somebody maintain their housing. Advocacy as well. You might have lots of landlord and neighbor conflicts initially when somebody's housed, right? You can totally, again, assuming you've had a conversation about disclosure with your participant, be able to advocate on their behalf with the landlord. Like, hey, yep, things have been a little bit rocky the past couple weeks, but we're working on it. I'm checking on them regularly. These are the steps that we're taking to, mediate some of these issues. All of that kind of thing, totally relevant. treatment planning as well. I don't think I said on the last slide, but treatment planning is something that should very frequently happen. We want to see that treatment plans are updated a lot. Anytime somebody meets one goal, we want to see that new goals are on there. Somebody can continue to be reauthorized for FCS services for as long as they continue to need support, right? So as long as they've got new goals, we can continue to work with them. There are folks that are enrolled today that have been enrolled in FCS since the very beginning in 2018 because they continue to have goals to work on and they still want the support, and that's great.
Anessa, there's a question about, is there a software program that we recommend for case management and Medicaid billing?
There are so many different ones, and I think
There
it definitely depends on your agency's budget, the size of your agency as far as like how many participants you're serving, maybe like how clinical your services are if you have clinical staff. I would say there's so many factors that go into it, but largely like how much do you need it to do and how much are you willing to spend would be the two biggest ones to consider. Just some common ones are Apricot, Credible. I am blanking on more of them.
Chrysanthemum's one of them.
Yep.
I will say we've got a documentation training coming up on June 26th, and maybe between now and then, Darren and Anessa and I can come up with kind of a list that each of you can research if that's a need. So please sign up for our June 26th documentation training, and we'll try and address it there.
Yeah, something I would maybe recommend too is try to connect with other providers that maybe have a similar like size of agency, similar scope of work, and just compare notes on, maybe what are they using. That's a good place to start, I think.
Good plan.
Let's see here. And benefits management, this is another important one to just help folks be aware of. Like, for example, if they are on a Section 8 voucher, they've got to, report income when that changes. Make sure folks are aware of that. Coach them through how do we fill out the paperwork to report an income change so you don't get in trouble and end up owing back rent. Things like that are always okay to help folks with. And again, landlord liaising, always. After your relationship with the participant, I would say relationships with the landlords are the next most important. And do set aside time in your schedule to meet landlords, meet them in person, network with landlords. You really want to get to a point with this kind of work where you have landlords calling you, saying, hey, I have a unit open. Do you have somebody that can fill it? Rather than constantly having to be in the trenches looking for units. Okay. Any questions about supportive housing services?
I'm watching the chat. So far not, and I do see that Maureen was, since I somehow managed to pick the PowerPoint that didn't have all the slides, Maureen is wanting to present about TAP. Do you want to move forward a little bit within yours and see if the TAP slide is in there? Otherwise, I can bring mine up.
Nope, happy to. I think we're right back where we're supposed to be.
Yeah, pretty close. I will send out, when I send the slides out, I'm going to send the slide deck that Anessa is showing now. There will be some additional slides in it. Once again, feel free to reach out if you have questions about them, and we'll be able to discuss them with you.
And I don't necessarily need a slide. I mean, if either one of you have one, first, can you hear me okay? Because I'm often quiet.
Yes. No, you're good.
Okay, great. So my name's Maureen Maple, she, her pronouns. I probably haven't met a lot of folks since you're new. So the first step is everything that everyone's been mentioning, just from chronologically. TAP is later in the process. So once you become an TAP, I'm the TAP program manager, which that acronym stands for the Transition Assistance Program. And that is, like Anessa was talking about, if someone needed to learn a little bit more about how, just how to live successfully in their apartment, that maybe the shower curtain might be an opportunity for learning. The TAP program would come in to the fold if someone needed that shower curtain, or they needed a couch, or they needed some of those transitional home essentials and sustainability items. It also has we can provide that first month's rent, application fees, just all of the things that someone would need when they're first transitioning into stable housing. So it's a flexible funding source that can cover all of those housing related fees. So move-in costs, first and last month's rent, deposits, and any non-refundable fees. And then, like I was saying, those home essentials and sustainability items. And that would be like the shower curtain, a couch, some of those essentials just, but we've approved different things. So there are exceptions to policy as well. Some moving expenses like the credit check, just all of those things. So I don't know if I actually can't see when I'm in the chat either. So, or I can't see the chat. So basically, that is kind of what TAP has historically covered. And then some of what we were talking about with the upcoming rental assistance piece, there's HRSN, which is Medicaid funding, stands for health-related social needs. And there are two different parts of that. So it's a lot more funding coming in that we're looking to roll out as soon as possible. We don't have a hard date for that. But the HRSN TAP will add some services to that as well as funding, and we will be able to provide still the same essential things that we have been providing with the transition assistance program. So that first and last deposit and all of those home essentials and sustainability items. And we will add a couple of services, but we won't be able to do that immediately. So we'll talk more about those as they roll out. But TAP will work in tandem with that HRSN 6 months of rental assistance. So all of these are intended to pair with each other and to meet people where they're at as far as sort of what their needs are and just to have all these different resources. So this is something that you can, a resource that you can provide for your clients as they're just embarking on that process. But the first step is ensuring that they have Medicaid and it's active, and then to connect them with FCS, and then our partners over at Wellpoint. My counterpart's name is Joe Elder. Joe is who and how you'll connect them with TAP. So I'm here to, if you need to reach out or ask any questions, and then Joe will be present at all of the advisory council meetings just as these updates are made, as we add those HRSN services, and he can really walk you through all of the process about how to access TAP and then how to submit requests for TAP. It's pretty straightforward. It's a pretty easy process to participate in. And again, just like all of everything that we've already commended Wellpoint for, it's a really quick process, really communicative. I mean, we couldn't ask for better partners. And so, yeah, I look forward to getting to know all of you and supporting you and the people that you're working with all of these resources. Really, really thrilled about, it's going to be a substantial increase. So we've ran out of funding the past couple of years. I see your hand, Annette. Hi.
Oh, I can wait until you're done.
Oh, no, that's okay. I'm just it's a real broad overview, and I see now that the slide's there, and I wasn't planning to read off of it. Let me just say real quick what's changed, and then that's pretty much everything I needed to say. So it's essentially the same. That $5,000 is probably going to change, and we have kind of tried to veer away from that just because it can really vary a lot depending on kind of where someone is. And so that was where we started initially, but it may be that someone lives in an area like Spokane or King County, and their first and last may exceed that $5,000. So we're just kind of working always to improve and increase, make it equitable and provide the easiest access, lowest barrier access. But take it away, Annette.
Outside thinking is what I would have added with the whole more than 5,000. I was just going to ask about ways of paying, how to help people get property maybe so they can build their own homes, or if there's ways. I will put this in every Zoom I can about putting two funds together, crime victims for dog shelters, because you know how our funding is low for help. So
And
that's one of
so
my
there,
things.
yeah, those are all great points and questions and suggestions. We're really trying here in DBHR at HCA, so the Division of Behavioral Health and Recovery. Sorry, so many acronyms. One of my coworkers says we work in the acronym mines, which I think is really funny and kind of true. But
I
I'm
we,
love
big
that.
for
yeah, we're trying to pair, we talk about braiding and weaving a lot. So there's so many more subsidies coming into the fold. Right now, these are not intended or not, a lot of the way that we operate these programs is coming to us from Medicaid. So what the intent of the program is. So right now it's not just to provide those resources towards someone building or buying a home, but that may be something that there are resources coming into the fold around. And yeah, I right now don't have anywhere to point you around that, but I think that it's something we're all thinking about, and we're just so grateful right now that we're able to provide everything that we are. I mean, I don't know. I have lived experience of being unhoused, and I don't know if I ever thought I would see the day where, being able to buy a couch and get all of that assistance to get in, literally get your foot in the door. So right now we're just, ecstatic that we're able to do and we keep being able to do more, and the funding keeps expanding. So it's
It's
all,
awesome.
yeah. And thanks for being here. And that's kind of all I've got. I'm looking to see if I see any more questions. Did I miss
No
anything?
more questions.
I'm
Okay.
just happy about the resources, like actually finally sharing resources with each other, because over here in Kitsap County, we don't get resources. Like, I would have never known about any of this if I didn't find a flyer about Pittsburgh. Acronyms, Family Youth System Partner Roundtable.
I was like, that's a new one for me. So,
Mm,
well, hopefully, Annette, Kitsap County, and all, I know Kitsap's a pretty big county. I mean, it serves Bremerton, so it's a really kind of a broad range of folks that are being served, and also those resources go really quickly. So, what I can say about that is, now that you know, tell everyone to connect with FCS, anyone that you know that needs these services, and TAP will be much more robustly funded. I mean, I think somewhere like 6 times more. So we ran out really quickly, which showed, that we need more money to be able to help more people. So we now are receiving that, and ultimately we'll add more services as we're able to. There's a lot of system updates that have to happen to do that, but we are working on it, and we're just so excited that I think we'll be able to make it last through the whole year. And so, yeah.
yay.
Yes,
Yay.
yay.
Hey, I wanted to say, and it's not in a slide any place, but just because this is an FCS 101, some of you I know are FCS providers already, some are not. We send out training notices in a newsletter. And if for some reason you want to be added to that newsletter, if you're not already, reach out to one of us that I've already put the emails in the chat to ask to be added to the distribution list. When there are changes like more money for the TAP program and things along that line, very often those are in our newsletter as well, over and above registrations for training and things along that line. So feel free to send an email to us and ask to be added to that distribution list. I'm going to ask that you not put those things in the chat, just because the chat has now gotten so huge, I would have to go back and sort to find them, or one of us would. So send us an email if you want to be added to the distribution list. If you're attending today as another ANESA and want to be sure to get the slides and the recording, those kinds of things, send us an email, please. All right, I think Anessa, since you've got the slides going, I was kind of looking through them to see what else we have time to discuss today. And I know that we've already kind of gone over Glidepath. I don't know that do we have anybody that's going to talk about AHAH-RAP? Or does Anessa, do you want to do that?
Sure, yeah. The Apple Health and Homes Rental Assistance Program is super cool. It is brand new. It's a partnership between HCA and Commerce. And basically it prioritizes FCS enrollees. It prioritizes folks who are chronically homeless and folks who are who have been in an institutional setting. Those are the folks who are prioritized to get a unit. It's like a weighted raffle, essentially. It provides short-term rental assistance. I believe it's 6 months to cover the person's rent. Essentially, Commerce pays their rent for them. And it's 60 vouchers for the whole state of Washington. It's spread over the whole state. There's a few per county. Our Apple Health and Homes program manager is not here today, but we can also, Don, would you mind putting Elizabeth's contact info in the chat if folks have more questions about it?
I can sure do that.
Yeah, this is a really cool program. It's very exciting. Like Maureen was just saying, people are literally getting their foot in the door of housing with this. It is so exciting. I can't speak highly enough about it. Oops. There's more slides. Perfect. So folks who are eligible are folks who are already enrolled in foundational community supports. They have to be 18 or older because it involves signing a legal lease, and folks who are 16 and 17 can't do that, obviously. And they have to be currently experiencing homelessness, which is one reason why folks who are chronically homeless are weighted as a high priority for those vouchers. Wow, all of this would have been helpful in talking you through that just now. So they have to meet the criteria for the rental assistance program. That gets the assessment, the Apple Health and Homes assessment gets submitted, and then that results in them being entered in the randomized weighted drawing with accordance to what their risk factors are. And submitting those assessments, there is a link here. This PowerPoint will be sent out to folks, so feel free to have folks fill that assessment out.
So I did just put Elizabeth's email in relationship to the AHAH-RAP programs. And
Priority
Maureen, your email too.
Sorry.
Sorry.
Priority population number 1 is folks experiencing chronic homelessness and currently meeting the definition of homelessness. So living somewhere that is not fit for human habitation. And priority population 2 is folks who are experiencing the frequent or lengthy stays in residential care, which is 2 or more contacts within the last 12 months or 90 days or more consecutively. And then we already talked about Glidepath, right? Darren
We
covered
did,
that.
yeah. Darren talked about Glidepath.
Okay, I think that might be everything then. I'm going to stop sharing and double check if there's anything we want to go back.
I think that's a good idea.
Yeah.
Anybody have any questions? Any thoughts?
Dawn, is it
You guys
okay?
are amazing.
Can I just say one more thing, Dawn, just about
Please do.
with the AHAH-RAP, those programs are similar to, so the HRSN piece of that will be additional funds, and that's the 6 months of rental assistance that Anessa was talking about. So that is a position that we're hiring for. That's not, that hasn't been rolled out yet either. It may be that it's close to when TAP comes out, but they will, eventually they'll work in partnership with each other. And so that will provide, go from that first last deposit and those home essentials and sustainability items that someone needs to gain housing to stabilize. And then that 6 months of rental assistance will be an opportunity to help someone get that much closer to maintaining a long-term housing. So there's, more to come on that, but that is something to be on the lookout for, and something, that we're, again, it keeps getting better. So keep, making the suggestions, and we'll keep putting them forward. So, but just wanted to mention that too. And sorry, leave the last few minutes for any questions people have about all of that. Thank you, Anessa and Dawn and Darren. You're amazing. I'm always so impressed with everything you can transmit in such a short amount of time.
Thank you, Maureen. And appreciate the fact that you brought up the information that you did, because that's all helpful. And once again, Maureen mentioned we covered a lot in a short period of time, but we didn't cover everything. So don't feel like this has to be the end all be all. If you have additional questions, you've got our contact information now, and it is definitely on the last slide of the PowerPoint that's going to be sent out. Maureen, I think yours is on there too. If not, folks hopefully have copied it down, or we'll add it to that slide. But I think yours is on there too. So feel free to reach out to us when you have additional questions. That's what we're here for. And we really appreciate everyone that's attended today. And thank you for your patience with some of the speed bumps in the road, because there have been more than I like to even think. So thank you for your patience with that. Yes, indeed, we are real life, and today was real life, and I'll be glad when this week is over, because it's been sort of like that. All right. I'm not seeing
You guys
additional
are amazing.
questions. Oh, thanks, Annette. I'm glad you were able to attend today. And we hope to talk to all of you at some other point in time.
I'll give one more shout out to Brandon and Lisa and our Wellpoint partners for being here too, and always just being so professional and doing such a great job. We could not do this without you. So thank you as well.
Absolutely. All right. So everyone take care, and we'll talk to you next time.